The information provided in this podcast is for educational and informational purposes only and is not intended as medical advice.
Hey, it's Nikki. Thrilled to hand the mic over to our friends at TestRx MD. You might remember David and me sharing our pretty in-depth health journey last year, from a devastating diagnosis to our taking health by the driver's seat. We chose to partner A to B first with the health professionals that have helped us most. Collectively, David and I, we lost over 60 pounds, and so many other aspects of our health have us feeling more lively and confident these days. So look, we're on a learning journey with you, and we know you agree. Health is so crucial to our ability to live our best lives. P.S. Don't wait to hit this team up at TestRx MD for a free concierge coaching call. There's a link in the show notes, or feel free to ask us. But this action could be the start of a whole new you. It was for us. So I'm passing the mic to our partners at TestRx MD.
Hi guys, John here with Activate Your Best Health. We have Dr. Saddoris on today so that we can discuss kind of some cutting edge therapies that aren't normally considered traditional Western medicine. We're going to be diving into some peptides today. We're going to probably split this up into actually 2 different episodes, since there are so many peptides and so much information that is associated with those. So we'll go ahead and dive right in. And if you guys like any of the therapies that we're talking about today, feel free to click the link below and you guys can access the free consult link to schedule time with either one of us, or go ahead and click on the intake form if you want to go ahead and take the plunge. All right, let's dive into it. So let's look at PT141. So we're going to get into some sexual function and libido first. I guess I'll break this down in chunks for you guys so that it's easier to follow. So after we get into that, we're going to get into growth hormone optimization. Then we're going to move into actually a really cool one of my favorites, the tanning and metabolic enhancement category, which is pretty cool. That's also known as the quote unquote Barbie peptide. Women like to use that one to get summer body ready, which is kind of a funny name, but it honestly fits the category quite well. And then we'll get into some healing and regeneration. So a lot of people may be familiar with BPC 157. That's kind of the big 500-pound gorilla in the space. But there's actually something that's even better. And we'll kind of get into that as well. And then moving into the next episode, we'll start looking at...
it's going to be regenerative medicine that we'll be looking at.
Yeah. We'll get into the regenerative medicine as well. So let's dive right into one of our most popular peptides, PT141, also known as bremelanotide. That's kind of a mouthful, but that's how you say it. Dr. Saddoris, can you explain what makes this peptide unique in the realm of sexual wellness?
Yes. First, before I start on peptides, I just want to let you know that, a lot of these are natural products that actually stimulates our natural system in ways that improves in performance. As we age, these levels drop. And so a lot of times we need to supplement to get those levels back up into a more normal range so it slows aging down, but also improves function and how we feel. And the PT141 is, so important because, unfortunately, as people age, their sexual desires and their sexual ability dramatically drops. And so the thing that this does is it works both on the physiological part, which is the part mechanism of your body that has kind of, over time kind of decayed and just hasn't become like it was before when you were younger. And then also the psychological part, which is dealing with the part where, when you mentally start having performance issues or you start having lack of desire, and how that affects how you feel about yourself and your well-being. So this medication works differently than, if you're just taking something to help for sexual performance, which is the E5 inhibitors, like Viagra, those products that are out there that just increase blood flow, usually more effective in men to help them maintain or sustain an erection. But it has nothing to do with help with arousal or interest or enjoyment. And so those parts are also affected in people. And this product works on what we call neural activation. It's actually stimulating the receptors in your brain, mainly the melanocortin receptors, MC3R and MC4R. And this increases the sexual desire through the hypothalamus, which is the part of the brain that controls the pituitary gland, which we always call the master gland in our body. But it's kind of the hidden puppet master behind it. So when it stimulates it, then it activates those hormones that enhance natural arousal. It also works independently of the vascular component, which is, using the Viagra. And so sometimes they work very wonderfully together and helps with maintaining erections. But even on its own, without using that, it does help improve erections and also physical desire.
I do love the fact that it does hit it from the desire side, and also that it seems to work really well in women, which is a big deal since there's not really a lot in that space, it seems like, for women.
Definitely. Being a woman, I understand this completely. Unfortunately, as women's hormones change, especially as their estrogen levels drop and they get vaginal dryness and they get discomfort, and a lot of times, like a lot of women, I have a lot of women come up to me and says, I just don't really want my husband to touch me. I just don't have the interest, and yet it affects the relationship, because, sexual actions is really what brings emotional bonding between people. And so a lot of times divorces happen, in people that are perfectly compatible, except in their sexual drive. And so this is one thing about this product is that it's been FDA approved for pre and menopausal women, and they call it HSDD, which is hypoactive sexual desire disorder. And it is this very common problem. And it's just that they have just persistent lack of sexual desire. And it causes emotional distress in them because they know it's affecting their partner, but it's also affecting them and how they see themselves as an attractive, wonderful woman. And it also reduces sexual desire and the sexual satisfaction and the quality of their life.
Increases sexual desire. I think
Yes, it does. I'm sorry. Yes, it increases sexual desires and it improves the quality of their life. And so it improves the arousal response. And this is, what we call foreplay. And so women, because they do tend to climax a lot slower than men, this is a very critical phase in activating sexual desire. And so it also reduces the anxiety about intimate encounters and definitely improves the orgasm, but also the intensity of the orgasm. And so I think the other part in men, they are very much more involved with anxiety about the intimate encounter, especially if they've had some unsuccessful responses, that they get aroused and then it suddenly is not there anymore. And, or the libido is decreased and with a partner that has an increased desire. So, erectile dysfunction can be very difficult mentally, and it makes it emotionally challenging sometimes to want to continue when you're having those problems. But this does help. And again, it does help with taking other products with it, which we're going to talk about later, some combinations. And they found that even when, some men take Viagra or Cialis and it doesn't seem to work. I mean, it doesn't work on desire, so just because you can have the erection doesn't mean that you want to perform it, so it does help with definitely the desire and performance anxiety.
Awesome. So I like how we kind of covered that on both sides, both men and women. So now I guess we can kind of bridge over to optimal dosing protocols. We want to make sure that we're giving you guys, a lot of information. It may feel like that we're kind of throwing it all at you through a fire hose here, but we really want this to be solid information. So even if you guys don't go with any therapies here with us at our clinic, My Body Health and Wellness, you'll at least know general information that you can approach your physician with or your provider with to make sure that you're getting the optimal effects.
Yes, I think it's very critical to know proper dosing. It's just like, how do you take a medication? some medicines, like if you're taking a sleeping medicine, you're not meant to take it in the day when you're meant to be alert, right? And so a lot of these peptides, because they are stimulating your natural system, it's so important that we mimic the process that our natural system does, except we're going to increase the amount because as we age, those levels drop dramatically. So we're not really giving you excessive doses, but we are giving you doses that are going to be in more like when you were in your 20s and 30s, right? Which is where you were at your prime, right? And so on this product, starting dose is 1 milligram, which is 1,000 micrograms per use. And it's so important that on this, because it is associated with sexual desire, performance, that you want to take it about 4 to 6 hours before your anticipated activity. This way, it allows it, because it's stimulating your own hormone response, it takes time for it to get to the brain and for it to release the chemicals and to get it into your system. And so it's not one of those ones you take it and you are ready to go right then. It just doesn't work that way. It is given either as a sub-Q injection, usually in the abdomen, or it can be as a nasal spray. And like anything, if you're excessively using something, your brain can develop tolerance to it. And so the frequency is recommended not more than 2 to 3 times per week maximum. And then duration effects really varies from person to person. They say 6 to 72 hours, but I think optimal dosing, especially when you're starting out, you want the optimal dose because you want to make sure it works so that you get the confidence in it. So the 4 to 6 hour interval is the best. And then also, again, to reduce the brain from developing that tolerance, you want to cycle it. Maybe use it for, 8 to 12 weeks on, and then give yourself a month for your brain to reset. Because the brain is set like your body. It has something that's called homeostasis. And when something is being constantly stimulated, then the brain will produce things to offset it, to reduce it, to bring it more back to normal. And so that's where the 4 weeks off, it's kind of just restoring those receptors to respond normally back to it. Because if you keep stimulating it, it's going to have less effect over time. So the other thing is, always side effects, or how do we maximize it? If you take it on an empty stomach, it does help reduce some of the side effects of some mild nausea that you would get, especially if you're eating a high carbohydrate diet. That can also increase your nausea. You want to make sure you're drinking a lot of fluid because, sexual intercourse is a cardiovascular exercise and you need a lot of fluid to help maintain your function. You're going to sweat. And then also always start with a lower dose to assess your response, because every person is different. And then because it is a cardiovascular event, you can get flushed because you're increasing your circulation, and that can also increase your blood pressure. So sometimes if you're having hypertension problems, this is probably not a product to use at this time. Or if you have a bad heart, we certainly don't want to give you a heart attack over these things. And that, I think this is so critical, is that you need to see a provider that is knowledgeable in not only the dosing and the side effects, but also the general medical health, to make sure that the products are safe for you and that it will be effective for you, and that will try to reduce any unknown or unwilling consequences of taking something on your own, thinking, oh, I can do this myself, and not realize that maybe you're not the best candidate for it. And that's what we'd like about this product, is that we look at you holistically and not just looking at, hey, we made a cell, right? We want to make your body to be its prime function, but we also want you to be healthy.
Awesome. Now comes the fun part. Let's discuss something super interesting for me personally: stacking protocols. What combinations have you found while at My Body Health and Wellness to be most effective?
I think the one that's probably the best is the PT-141 and the oxytocin stack. Oxytocin is associated with joy and happiness and pleasure. It is something that, when you're doing something you really like, you get this like extra kick inside. That's what that hormone is doing in your brain. It reduces depression, anxiety. It gives you a world view of a positive outcome. So it enhances your emotional connection to your partner. And so if you're having partner issues, where there's conflicts and stuff like that, especially when it's over sexual performance problems, which may not be addressed as it, but it is a big component, this will enhance your connectivity with each other. It does improve because the pleasure, your orgasm intensity is much more and more bonding. The dosing is, you have timing a little different. With the PT-141, you take the 1 milligram about 4 hours before, which we talked about before, 4 to 6 hours before. And then the oxytocin is a much shorter acting product. And so you want to only take it 30 minutes before you do the dosing.
Yeah, that's probably my favorite combination as well. It's the oxytocin. What's another stack that you are a fan of?
Yes, I think this one I like for men. As they get older, they get something called atherosclerosis, so they get a little decreased blood flow, and it usually affects the penis first. And so when men have problems with sustaining an erection or even having an erection, it's usually from circulation. So I always tell people you should always be evaluated cardiovascularly because it's not just there that you can have circulation problems, you could have it in your heart as well. But there is this PT-141 plus citrulline stack. And this citrulline acts just like Viagra, Cialis, those products, because it does increase blood flow through the penis to increase the erection and the firmness. Its enhanced blood flow gives you better endurance, so it's not like it suddenly drops on you, gives you improved stamina. You do have to be wary because this does act like Viagra or Cialis in the sense that if you happen to have chest pain and you take a nitroglycerin, it can bottom out your blood pressure and you can sometimes die from that. So it's very important that if you do take this product, let your partner know. So if someone comes in to hand them a nitroglycerin, they'll say, so don't give him that, right? Because, then he suddenly may not be around because the blood pressure can drop dramatically. But the dosing is the PT-141, 1 milligram, and you take it again that 4 to 6 hours before. And then the citrulline, again, it's a shorter acting product than Viagra or Cialis. So you take it 1 hour before. And this will give them the combined benefit for those who have those issues.
Awesome. I know another one that we're going to be touching on later too. It's another peptide that we're going to be covering in kind of the Barbie peptide that I mentioned earlier. I know that's a pretty popular stack to go with PT-141 as well.
Yes, this is going to be the PT-141 plus the Melanotan II stack. I think the interesting part is that a lot of people were using initially for tanning, but they found the unusual side effect of having sustained erections.
So unusual.
So unusual, right? And because of that, became, wow, this is a great combination, right? And so it doesn't on its own, though, it has improved arousal, and sometimes it decreases arousal. So that's why it's a great combination to use with the PT-141, because that does overcome that decreased arousal that just using that product on its own. It does enhance skin tanning. It does improve mood. And so this is kind of nice that both of these products can be administered at the same time. The PT-141 is 1 milligram and the MT2 is 250 micrograms. They usually recommend before you do the combo, though, is that you should try either the PT-141 by itself or the MT-2 by itself separately, because you might find that you may not need the combination, or two, you might find, the increase in nausea between the two of them might be more than what you want to experience. But again, taking on an empty stomach dramatically drops that issue of concern.
Those are some pretty incredible stacks. We kind of threw a lot at you guys there. So let's move into the final piece of the puzzle here is, we want to make sure we're giving you all the good information. We're not just going to hit the highlights. We want to make sure that you're aware of potential side effects and some considerations as well, so that you're able to utilize these products safely. So let's kind of move into some side effects and maybe some contraindications as well.
Yes. I think side effects is flushing again because you're increasing blood flow. Okay. It's not going to be permanent, but are you going to get flushed? Usually the mild nausea, but it usually subsides. Again, because you're increasing blood flow, sometimes you can get a headache from it or slight headache. And then you can get a temporary increase in your blood pressure. That goes into the contraindications. If you already have uncontrolled high blood pressure, you certainly do not want to add to that. And so that's so critical that your blood pressure is in a pretty normal range. And then if you've had any recent cardiovascular events, or if you have significant coronary disease that, putting extra strain on your heart might potentially cause you to have a heart attack. Or if you develop angina, you can't take nitroglycerin with if you're on the citrulline component. And of course, anytime a woman's pregnant or breastfeeding, we just don't recommend you really taking any kind of over-the-counter product just because you don't know how it's going to affect the fetus. And then in terms of using the NT-2, if you have melanoma and you're stimulating the melanocytes to produce more pigment, you're going to be increasing that melanoma speed of growth. And you definitely do not want that to happen. And I think one of the things that they do recommend is that you should have dermatological skin testing to confirm that you're not developing that problem, and periodically have it reassessed to make sure that you're not creating a potential very malignant cancer from killing you over time.
Awesome. Well, that was a pretty robust explanation of PT 141, one of the more robust explanations that I've personally seen. Let's go ahead and switch gears and get into growth hormone optimization. So this is probably going to be a pretty popular segment here for a lot of people who are wanting that extra edge, or maybe something that they can add to their TRT. It can work really well standalone or on top. We'll kind of get into some of that stuff as well. So let's move on to Sermorelin, a pretty fascinating peptide that's truly revolutionizing how we approach growth hormone optimization. Dr. Saddoris, can you explain why this peptide is so significant?
Yes. I mean, I think the biggest trouble when people hear growth hormone, they see these images of, I don't know if people remember watching these shows where they have these large hands and big jaws and really tall thing because they've been overtaking growth hormone. And so in their image, they're saying growth hormone is really bad for you, but not realizing that, as we age, our natural growth hormone drops dramatically, and that affects our quality of our life. And so Sermorelin, what I love about it is, one, it has extremely very minimal side effects, and it actually works on your own natural pathways. It stimulates the pituitary gland to release the natural human growth hormone. And so when you take it properly, you want to mimic your natural cycle so that you can get all the benefits, but you're just getting a little higher level than you normally would produce to get it more into the range, again, in your 20s and 30s, because that's when you were at your prime optimal state. Your muscles were strong. If you did overdo it, you recovered very quickly. Your body was elastic. It didn't tend to get as injured or fractured or weak. You had energy, stamina. You didn't have the weight gain issues that you get as you get older. And this is what we want, is to get you back into prime metabolic function. So how does it work? It works by doing the natural pulsatile growth hormone release. And that means we take it at bedtime. That is when we normally start releasing growth hormone, is at nighttime. And so we want to mimic that same response so that we're getting the optimal level increase. If you take it in the morning, because it's not stimulating your natural response, you may get a little bit, but it's like the difference between 1 or 2 or 10 response, right? And then it's not affecting your ability for your own body to mechanism to keep things in balance. And we call that the hypothalamic pituitary axis system, which is what keeps all of our hormones kind of in balance. Our glucose producing hormones, which is, glucagon and cortisol. Also, our sex hormones are all involved in all of those things. And so we don't want things to be out of kilter. We just want to make it be more optimized, okay? And it restores our naturally declining growth hormone as we age. Because as we get age, we get more fragile, we get more weak, our memory declines, our strength declines. I mean, there's even one study showing your grip strength tells you kind of what your age lifespan is going to be. I mean, that's kind of scary. And so, these have all these benefits. It makes you have lean muscle, not fatty muscle, but lean muscle that is very slenderizing. It reduces your body fat, especially in the abdomen. One of the benefits I think people that will first notice is improved sleep quality. When you sleep, we go through different phases of sleep. Everybody hears about the REM sleep, but they don't know the slow wave sleep, which is where we have a restorative phases where our body is getting recovered and strengthened and repaired. And so it's allowing all of those phases of sleep to be back into a normal state. And when we're under stress, which who isn't under stress these days, those sleep quality markers are dramatically impaired. And if you take a sleeping pill, it only worsens the state. It may make you groggy, but it doesn't actually make you feel more functioning and more alert. It also helps the recovery and healing. A lot of people don't realize that our immune system is so important and the growth hormone is needed for that process. So, reduce infections, reduce incidence of cancers, makes your skin more elastic. So you have a younger, youthful appearance on your face, but it's your whole body. And then, of course, our bones get weakened as we age, and it improves our bone density and makes them stronger. So we're less likely to have sudden fractures. And as we age, we always say, oh, that was a senior moment, or those kind of things, or trying to recall, our processing speed is actually improved and just increased generally vitality of just feeling better and energy.
Definitely. These benefits are pretty incredible. It's almost like the fountain of youth drug right there. Can you detail the optimal dosing protocols?
Yes. I mean, there is a range. And I always say, if you're older, older meaning like maybe 60 or older, you may want to even start a little lower initially and go up. But the standard dosing is between 200 and 300 micrograms daily. And this is given in sub-Q. Again, you want to do it at bedtime on an empty stomach because you want all your energy to be focused on repairing rather than digesting your food, right? So it's not because of nausea, it's because of the way your metabolic process is going on. And then you can go up to advanced doses of 500 micrograms daily. Typically, we don't want to go higher than that because we want to maintain our normal physiologic responses and maintain that pituitary and hypothalamic axis. And you do tend to cycle it, again, to reduce tolerance. And it can be 3 to 6 months with 1 to 2 months breaks between the cycles. And then there's timing. No carbohydrates 2 hours before because, insulin's released then and insulin turns all your food to belly fat. But we're taking the growth hormone to eliminate belly fat. So we're kind of competing with those things. Don't eat 2 to 3 hours before you take it. And again, at bedtime. And there are some combined supplements you can take to enhance the effects.
So yeah, let's go ahead and dive into some of the stacking protocols. It's an easy segue there when you just talked about enhancing effects with other compounds. What combinations have you seen that produce the best results for people?
Yeah, I think really the best results is using Sermorelin with CJC 1295. Sermorelin is a short-acting response, maybe 2 or 3 hours at the most. The CJC 1295 has a much more sustained response, and it gives it more consistent levels. And so a lot of bodybuilders really like this because it really does enhance the muscle growth that you can get, the fat burning, and because of its sustained results, you just feel better all day long. I think that's probably the best combination. So usually you dose Sermorelin 200 micrograms, and at the same time you give yourself a sub-Q injection of CJC 1295 of 100 micrograms, and you can give them both at bedtime. And it gives you a 24-hour coverage. And like I said, gives you so much better results.
Yeah, that half-life is much longer.
Much, much longer. I mean, you're looking at a 24-hour interval versus 3 to 4 hours. So, and then there are other stacks that we use. They have Sermorelin with, they call GHRP-2, which is growth hormone releasing peptide 2. And this acts like ghrelin. Ghrelin is a hormone that increases your appetite. So for men that really want to bulk up, this is a nice combination because it really stimulates appetite, gives you lots of food, and so you get a lot of muscle building. So it does have a synergistic effect on growth hormone release, and again, improves fat loss, and you use them both together at nighttime. It's similar to ipamorelin, which is a direct ghrelin stimulator. So it has similar types of effects on it. I kind of like the ipamorelin because it's not a synthetic agonist so much as ipamorelin has lower side effects to it. But a lot of bodybuilders do like this combination because of the increase in muscle mass and strength and fat burning they get.
I know a lot of people would interchange sometimes the GHRP2 and GHRP6 as well. So just want to make that aware.
Yeah, that would, and they're both peptide hormone. They both work in the same mechanism. I don't think there's really a lot of significant differences between them.
A lot of that's sourcing, I think.
Yes, exactly right. Where you can get it, right? And is it good sourcing? Because unfortunately, there's a lot of knockoff things that don't have what they claim. But I think what's interesting, though, is that a lot of times when people have surgery or they've been ill, they've lost body weight and they've lost muscle and they've been weak. And so a lot of people that have had significant surgery, especially like cancers or things like that, it does accelerate their strengthening and getting their muscle mass restored quickly for them rather than taking a much longer time to repair. So I think that has a kind of its own little niche there for, I think, that population that a lot of people don't think about. Again, there's a lot of peptides out of there. There's a lot of misinformation about peptides. And so it's so important that you go and see someone that specializes in it. Most doctors are not familiar with peptides. They're not trained in them. I've been doing anti-aging studies and been doing that for several years. And, it's important that we're looking, again, at the whole person. So another combination is using supplements with it. And again, I think some of these have also effects on the body itself, like Sermorelin with L-arginine. L-arginine is basically, citrulline is a derivative of arginine, which again works on increasing blood flow. But because it does have an enhanced growth hormone response, and L-ornithine also supports growth hormone secretion. So these are things that can kind of bump up the dose a little bit or maybe enhance its effects a little bit more by improving circulation and distribution of the hormones. And then, gabapentin improves sleep quality, and zinc is always important for hormone production, mainly male hormone and female hormone production. And vitamin D is like I call the master, I should call a master hormone. It's involved in so many cellular functions that you never want to be deficient in vitamin D. But it optimizes hormone function, but it also helps your immune system, reduces cancer, improves cardiovascular risk. I mean, it just has so many benefits. And so you never want to be low on that.
Yeah, that's one of the things that, I really started adding recently, specifically, I take now 5,000 IUs a day to make sure that you're not just getting the low dose of now, granted, any vitamin D3 is going to be, better than none, but 5,000 IUs is kind of the standard from what I understand.
Yeah, I think the biggest problem is, and this again, this is a lot of medical providers, the range of vitamin D levels is between 30 and 100. Now, granted, they never used to have a range. They just kind of arbitrarily came up with these numbers. But I think the thing is that you really want to be in the 80s or higher, And a lot of times when people see you at 80, they oh, they just cut back or stop your vitamin D. No, you're right in optimal ranges. It's also the ranges that are actually inhibit. Vitamin D is something that sits in front of your gene and prevents something from being transcribed. So if you have a cancer producing gene, it will sit there and either prevent cancer from developing in you, or if it does, it delays its development, or it also attenuates and reduces the intensity of its response. And so, regardless of what happens genetically, it has a dramatic improvement of your bad genes not being represented or as severely in your system. Yeah, I take it. I try to, I take 5,000 units a day. And, it struggles to get me up to like, in the 70s, so then I have to take some, milk or some other products with it to improve absorption because D does improve absorption if you take it with a fatty meal. And so, and taking it on an empty stomach, it doesn't give you the full absorption as you could if you take it with more food. And then when I started doing that, my levels came up more into the 80 range. And then they have advanced protocols, the Sermorelin with the GHRP chews, and then using the CJC 1295 and the ipamorelin, which is combined with the other. I mean, you're going to have massive weight gain with that, but it's muscle that's in these bodies. This is for experienced users. There's careful timing and monitoring. And, I don't recommend that unless you're really with another, advanced, knowledgeable provider. It's not something that you want to dabble in without knowing what you're doing.
Definitely. And I know a lot of times, like the CJC 1295 and ipamorelin, a lot of times, like a lot of compounding pharmacies will actually put those together. So it's not like you're going to be doing, 4 different injections here, right? You can kind of have some combos there.
Yeah, there are some specialty labs that can compound for you for those combinations. Some will, some won't. So it just depends on the compounding pharmacy.
So what about monitoring and safety considerations?
Yeah, so for monitoring, some people say we should check IGF-1 levels. That's an insulin-like growth factor. And our problem with measuring growth hormone is the hormone itself levels are fleetingly picked up. And because they're pulsatile, they vary throughout the day. So they're really not giving you an overall picture. But the growth hormone stimulates this insulin-like growth factor, and it promotes cell proliferation and making it form bone and your muscle and things like that. And so it's a more even level. So it's not up and down like growth hormone is. So I can give you a better idea of how that's doing. I don't know if a lot of people really check that, to be honest with you, but it is a measure that can be done if wanted to. I think your measurement is really going to be how's my muscle mass doing, how's my belly fat doing, and how am I feeling is probably going to give you a more ideal image. But for those who love blood tests, but if they don't understand what they mean, it doesn't do any good anyway. And a lot of people don't. So, it's a tricky combination, but it is something there. Especially if you're taking the products that increase ghrelin because you're excessively eating, you should be checking your sugar fasting just to make sure that you're not starting to develop diabetes or prediabetes. You always want to make sure your thyroid's functioning well. I mean, if you're taking all these products to improve metabolism, but if your thyroid doesn't work right, it's not going to do you any good. Okay, so this is something that should be checked before you actually do it. Cortisol levels also can compete and cause you to have problems, and those can be elevated with depression, increased stress, and there are some conditions that have elevated cortisol. And you do need cortisol to help produce your sex hormones as well. So, being at least having a basis sometimes is helpful. Just see where you're at, just see if there's anything there. And then checking your body composition changes, meaning what is your waist measurement doing? What is your muscle mass doing? They have these fancy scales that can actually tell you what your percentage of body fat is and what your percentage of muscle mass is doing. And those are helpful to see if we're having the results that we want. So, one thing is contraindicated is, if you have active malignancy, you don't want to stimulate those cells, right, to grow faster. And if you have diabetes that's uncontrolled, if your blood sugars are high or your hemoglobin A1C is not normal, in the normal range where you'd like to be, or at least less than 7, ideally 6.5. If you have intracranial hypertension, that can lead to a massive stroke, because of your fluid retention, things like that. And again, always pregnancy or nursing. Typical side effects, sometimes you can get some injection site like irritation, maybe a little redness, because you are dealing with growth hormone. Sometimes your joints might get a little achy or a little muscle. You do have some water retention that tends to go away over time. And again, it does increase blood sugars. And sometimes you can get headaches. And those usually are temporary. And the headaches are usually due to the fluid retention. Because a lot of people that are prone to migraines, when you have fluid retention, it can trigger migraine headaches as well.
Well, that was a very robust explanation of the growth hormone secretagogue Sermorelin. We're going to probably cover one more segment here, and this is going to be the tanning and metabolic enhancement one. And then in our next episode on this peptides, like masterclass, I think is what we're going to kind of label this as. We'll get into the healing and regeneration and throw some more at you guys that way, because it's just going to be way too long. Okay, so now let's discuss Melanotan II, a pretty incredible peptide. It's pretty fascinating to me just because of all of its widespread effects. A lot of women seem to love it. It's gained a lot of popularity recently. It's known for not just its tanning effects, but it also has multiple other benefits. Dr. Saddoris, can you break down what makes this peptide so unique?
Yes, Melanotan II, which is called MT2, is a synthetic analog, and it actually stimulates alpha melanocyte stimulate hormone. Essentially, what it's telling it is trying to stimulate the cells that produce melatonin in your cells. And it has multiple benefits besides tanning. The receptors on it is MC1R, MC3R, and then we talked about the MC4R in terms of helping with increase sexual performance. But it increases the production of melatonin in the cells. And, when you have darker skin, it does protect you from UV radiation. We find this to be a natural way of protection. Especially some people have problems with using sunscreen and, some of the products they may be allergic to. Sunscreens wear off, and a lot of times we don't apply sunscreen like every hour. And if you get wet, you have to do it right away. And if you're sweating a lot, it's off, so it's just a natural protection. It does have effect of appetite suppression. So for some people that, struggle with their appetite, this has a natural way of reducing that. It also, if you have low levels of this in your system, it can cause fatigue, weakness, muscle aches, decreased memory, focus, trouble learning. So it does have some negative effects if you don't have enough of this. And typically when that happens, that's usually due to maybe having what we call biotoxins in your system, such as mold or Lyme disease. And so there are some criteria that you can look to see if you have that. And you have to have, of this list, about 10 of those symptoms. I went through it. I think I had 5, so I didn't qualify. But, it also activates the sexual function through the MC4R that we talked about before. And it also gives you even tanning, so you're not just having it just in certain areas where you've been sun exposed. So like if you're wearing a shirt that's a different color than before, you're not going to see this change of color on you. And it does reduce burning. So skin burning increases skin cancers, and you have a faster tannin response, and it lasts longer.
And there are even more benefits too. We kind of touched on those already, though, like the appetite suppression, enhanced libido, increased energy, and fat loss and mood. So we definitely touched on that a couple of times. Now, the interesting thing about this peptide is you aren't just going to take one dose like you would with, I don't know, name another like medication, right? This one you have to like go through phases. So there's a loading phase and a maintenance phase. Can you kind of get into that?
Sure. So usually the loading dose is the first 2 to 3 weeks, and usually it's 250 micrograms daily. And then you can increase up to 500 micrograms as tolerated. And I think it's also depends on how much of a tan that you want also. And they do want you to have some UV exposure, 5 to 10 minutes, 2 to 3 times a week, which isn't prolonged, but it does activate you to produce more of the pigment. And then when you get into the maintenance phase, you don't need to do it daily. It's going to be 2 to 3 times a week, anywhere from 250 to 500 micrograms. And then your UV exposure is needed because now you have the protection. Before, you did short intervals of UV so that you didn't actually burn or increase risk for developing skin cancer down the line. And then the administration tips is, use it sub-Q, and they say it usually works best before you go into UV exposure. Again, because it's stimulating those receptors. If you have nausea, if you take it at night, that does reduce that. And it is important that we stay hydrated. I think our population in general just doesn't drink 8-ounce glasses a day of water. And because of that, our body's on the dehydrated state. And this does work systemically, of increasing blood flow and things like that as well. And so it's important that we stay hydrated. And then you can also start with lower doses to assess your tolerance. If you're a person that's real sensitive, then maybe start with a lower dose and you can just gradually increase as needed.
So one thing here that I really want to like double back on is since there are two phases here, there's the loading phase and the maintenance phase. I think you kind of gradually touched on it, but I really want to drive this point home for people. It is a scenario where, you can kind of adjust how tan you're wanting to be by how aggressive you are in the loading phase. And then that maintenance phase is just meant to kind of keep you there. So that is the part where you adjust how dark you're going to be, not necessarily like letting that bleed over into the maintenance phase and thinking, oh, why am I not getting darker? Well, you didn't load right. Yeah. So just make sure you're very aware of that. And now we'll kind of move into the stacking protocol. So we already covered, a very popular one, the Melanotan II and PT141. So we won't, rehash that one out. But there are some other nice stacks with Melanotan II that can be pretty beneficial. Can you get into those?
Yes, and I think this is just adding some natural products out, Melanotan II, and using L-tyrosine stack. Tyrosine is a natural amino acid, and it's involved in basically a lot of hormones and neurotransmitters in our brain, the thyroid, the adrenal gland. It affects the dopamine, the norepinephrine, the epinephrine. And so it really has a huge effect on how our body is functioning. And so it makes, it does improve tanning results, but because it affects the neurotransmitters, it improves mood. And usually the dosing is NT2, 250 micrograms. And then you use the L-tyrosine, 1,000 to 2,000 milligrams. And you usually take it in the morning. The other stack, which is more comprehensive, is again using the T2 and then the vitamin D, a wonderful product, and the L-tyrosine, which again, those are natural products that our body desperately needs to use. And then they have something that astaxanthin, which is something they use in a lot of the vitamins to help prevent macular degeneration in the brain. But it does help. It's a very powerful antioxidant. and it actually binds free radicals, which are particles in our body that damages our cell. And so it has a protective effect on our cells. Another powerful antioxidant is glutathione, which is also a very powerful antioxidant. And then also methylene blue is also a powerful antioxidant. But Xanthidine is the one that actually protects macular degeneration, which the other ones are not particularly been studied for that. So it just gives you that antioxidant support that I think all of our cells need, because when we damage our cells, it gets repaired, but the repair is never as good as it was before it was damaged. And that's what aging is: repeated cellular damage over time and getting less and less repair and eventually cell death. And then advanced one also is using the NT2 for tanning, PT141 for libido, the L-carnitine for fat loss. And it just depends on what your goals are, what you want.
Awesome. All right. Now, the fun part. Let's get into some potential side effects and then contraindications.
Yeah, and the side effects kind of depends on what combination you're using. The facial flushing can occur, if you're using the can't even talk to me. If you're using it with a PT141, so sorry about that. The nausea, increased libido. I mean, that's a really bad side effect. And appetite suppression. And then it can make your freckles darker and your moles darker, because you're increasing pigment. And the monitoring is so important. Regular skin checks. You really need to have your moles examined, blood pressure monitoring. And it's very important you do not get dehydrated, because that can affect your kidneys and also how your cells function. The biggest contraindication is melanoma, uncontrolled hypertension, of course, pregnancy, nursing, if you have really bad cardiovascular disease, and if you have autoimmune, because these are affecting how your immune system and pituitary axis is doing. We don't want people with autoimmune disorders to have those worsen. And I think ways that you can reduce side effects or risk is always start with low doses. Sometimes people want quick results, not realize that you get quick side effects, right? And you need to monitor skin changes, see a dermatologist, and then proper UV management, making sure in the initial phases that you're not doing excessive tanning.
Awesome. Well, let's see. Are there any specific tips for optimizing people's results while on this compound?
Yeah, as you mentioned before, make sure you do the loading dose. And the loading dose is going to be determining your tanning level that you want, right? So, a lot of people may not want the 500. They just may want just the glow with it, right? Or some of the protection. Some people want to have very dark skin, because if they're doing bodybuilding, it just shows their muscles more and their definition. And then consistent timing of doses and the gradual UV exposure, especially in the loading phases. Skin monitoring, as I mentioned, and you want the hydration. A lot of times evening administration for some things, and something are in the morning. Just knowing how they're supposed to be dosed and making sure doing cycling protocols if those are indicated in their treatments. Yeah, so it really needs to be personalized, because each one of these compounds can be adjusted, tweaked to make it more individual for you and your needs. And so it's so important that you see people that understand these products, know the side effects, the benefits, and how to dose it and how to monitor it so that you can get the optimal benefit that you have. I see so many people that will see this or start doing this themselves and realize suddenly that they're having issues or problems, and you do not want that. We're given this so that you can figure out how to do yourself. We just want you to be aware that when you do see someone, do they really know their stuff, right?
Definitely. Awesome. Well, thank you so much for your time. We're going to be getting into, like I said, the healing and regeneration segment next time, and then getting into the cognitive enhancement part as well, which I think is a pretty cool segment. And we just want to make sure you guys are as prepared as possible so that you can, as Dr. Saddoris just mentioned, you can ask questions, you can ask pointed questions so that you can make sure that providers, even outside of My Body Health and Wellness, can give you the best possible care and make sure that they're aware of certain things. So stay tuned in. Feel free to subscribe to the channel. Click the link below as well if you guys like any of this information and want to set up a free consult with either of us. And then we also will have the intake form if you want to go ahead and take the plunge and get the ball rolling on therapy. Well, thank you again for tuning in, and see you guys next time. Bye now.
So you just listened to this episode. Now, join us in being addicted to betterment. Please subscribe to the show, share with your friends, tag us, and please take a moment, leave a review. Yeah, we do want your stars, but we really want the feedback.